Good day, I'm Dr. Evonila Bito Alisa Devesa, and I will share with you topic about the suicide guidelines in the Philippines. Why why is it important to discuss about suicide? Though it is a topic that usually avoided by a lot of people, but do you know that in every 40 seconds, according to World Health Organization, there is attempt of suicide? So this is actually alarming, and I hope through this lecture you will be informed about how to help people who have depression avoid suicide and also to prevent suicide in the first place. If this lecture will help you, please feel free to like, share, and subscribe. Thank you. We have suicide first aid guidelines in the Philippines, and the discussion will focus on prevention of suicide and how to determine if the patient is already attempting or planning suicide. There are signs a person may be suicidal. There will be a dramatic change in mood, behavior, or appearance. For example, expressing in words or actions such as hopelessness, worthlessness, guilt, shame, or having no reason to live or no purpose in life. There are also patients who are withdrawing from friends, family, or society. Identify if the person is also expressing in words or actions loss of interest in things that were previously of interest, like going to school, going to work, or doing hobbies or interests like sports. There is also sudden or dramatic increase in depressed mood. Describing oneself as a burden to others or stating that others would be better off without him or her. Someone who is suicidal may threaten to kill oneself or say that he or she wishes to die, verbally or in writing. This may be very direct, but is sometimes subtle. There are also patients or persons who post in social media about the wishes to die or wanted to kill self. Always watch out for a person is looking for a way to kill oneself, seeking pills or poisons, weapons, or other means. There are patients who have attempted and those who have died of suicide who took medications of their parents or their primary caregivers. Those parents or primary caregivers who have maintenance medications and they take the whole bottle or the toxic doses of those medications. There are also patients who have access to seeking information about possible suicide methods, unexpected jokes about death or suicide. Watch out for expressing in words or actions of feeling trapped, like there is no way out or that suicide is the only solution to one's problems. There are parents who have claimed that their child who have committed suicide was very shy type of person, very good, and would always be silent if there is a problem. Being silent is not a good prognostic indication that the child would not attempt suicide. That means you should know how the child cope with problems or with setbacks or obstacles in life. So it would be very important to take note of it. Also, watch out for expressing in words or actions the desire or hope that he or she will die, including praying that God may take his or her life. One may also behave in ways that are life-threatening or dangerous. Acting recklessly or engaging in risky activities seemingly without thinking, like extreme sports or other activities that can actually harm self. Engaging in self-injurious behavior, like cutting, poisoning, or hitting their head against the wall. Some also are stopping life saving medical treatments or medications. Those who are chronically ill, like having diseases that can cause their lives to be miserable if without those medications or treatments, elderly who are having a lot of diseases. Someone who is suicidal may try to set his or her affairs in order or make contact with people he or she has not spoken to in some time. There are also who are giving away valued possessions, asking others to take on responsibility for the care of people or pets, on the thought that they will be gone soon. There are also people who are contacting other people to say goodbye, make amends, or to ask for forgiveness. Person may show one or many of these signs, whereas some may show signs not on this list, such as rage, anger, seeking revenge, anxiety, agitation, sleep disturbance, starting or increasing tobacco, alcohol, or drug use. Substance abuse is actually a passive kind of suicide. There are persons who have significant change in the level of religious interest or preoccupation with afterlife or any dramatic change in behavior, mood, or appearance. There is a misconception that if you would ask a person about thoughts of suicide, it would trigger the person to think or start thinking about it. But no. If you have seen some of these warning signs and you suspect that the person may be suicidal, you should ask them directly. For example, you might ask one of the following questions: are you having suicide thoughts? Are you thinking of killing yourself? Don't avoid using the word suicide. It is important to discuss the issue directly without expressing fear or negative judgment. Doing so may help you to appear confident in the face of suicide crisis, which may have a reassuring effect on the person you are helping, and the person would think, he or she understands me. However, if the person is using alcohol or other drugs, you may not be able to believe him or her if he or she denies being suicidal. If you are still concerned, please seek professional help. How can you tell if the situation is serious? First, you will need to know if a person has a clear intention to take his or her own life. That means the person has plans. Or whether one is more in an unsure state of suicidal thoughts, like asking, "What is the point?" or saying that nothing can stop me. To do this, you need to ask if a person is planning to complete suicide. The three questions that you need to ask are: have you decided how you would kill yourself? Have you decided when you would do it? Have you taken in any steps to secure the things you would need to carry out your plan? Should the person have suicidal thoughts? When or how? You need to know about the following additional risk factors. Has the person been using alcohol or other drugs? The use of alcohol or other drugs can make it more likely that a person will act on impulse. Has the person made a suicide attempt in the past? A previous suicide attempt makes it more likely that a person will attempt suicide again or kill him or herself. Previous attempt is the highest risk for committing suicide. Ask the person directly if he or she has made a suicide attempt in the past or ask the significant others like family members, close friend, or religious leader. Does the person know anyone who has died by suicide? Having a family member or close friend die by suicide increases the risk. Once you have established that the risk of suicide is present, you need to take actions to keep the person safe. How can I keep the person safe? Never ever leave someone who is feeling suicidal on their own. You do not have to be with a person all the time, but you should check on that person regularly. Try to engage other people from the person's social network in preventing suicide. Ask the person if there is someone he or she can turn to for help or support. Ask the person if he or she would like you to contact someone for them, such as a friend, family member, trusted religious leader, or spiritual advisor. Try to remove the means of suicide available to the person if it is safe to do so. Ask the person to give you the things that are intended to use to kill him or herself. If one agrees, you should dispose of them right away. If one does not agree, call emergency services such as the police. If there is any risk to your safety, for example, if the person has a gun or another weapon or is agitated, do not attempt to remove the means of suicide. In this case, call the police right away. Tell the person's immediate family about one's intention to suicide, particularly if the person is a minor, under the legal age for adulthood. Ask for help from their relatives, friends, or housemates to ensure the person does not have access to weapons, poisons, or other means of suicide. It is better to work collaboratively with a person and others to ensure their safety rather than acting alone to prevent suicide at any cost. What about professional help? Make sure that you have the phone numbers of suicide hotlines that we'll give later, emergency services, and mental health professionals on hand in case of emergency. You must call or take the person to a doctor, psychiatrist, or other mental health professional right away. So I will show you the Suicide Prevention Hotline, Center for Health Development Western Visayas, West Visayas State University Medical Center, Western Visayas Medical Center, and Pototan Mental Health Unit. Call a mental health emergency team or whoever is responsible for responding to psychiatric emergencies. In particular, if the suicidal person is suffering from psychosis or using alcohol or other drugs, emergency assistance should be sought immediately. If emergency help is likely to take a long time to arrive, take the suicidal person to the nearest safe place like the church, hospital. The person needs to be involved in decisions about who else knows about his or her thoughts of suicide. However, if one refuses to involve someone else, you should still contact a professional. You should explain that this is necessary to ensure the person's safety. You must never agree to keep the person's suicidal thoughts or plans a secret. How should I talk with someone who is suicidal? Express empathy to the person and tell this person that you care and want to help. That must be sincere. You should remain calm and in control and try to appear confident, as this can be reassuring for the person. Encourage the person to do most of the talking and listen to them without expressing judgment. You should not argue with a person about one's thoughts of suicide. The threat of suicide may indicate that a person is trying to communicate how badly he or she feels, and this is often a plea for help and a desperate attempt to escape from problems and distressing feelings. You should therefore allow the person to tell about those feelings and their reasons for wanting to die. Help the person to understand that he or she has control over their suicidal thoughts and that these thoughts do not need to be acted on. Point out to the person the fact that he or she is still alive, and talking to you about their feelings means that they are not quite sure about suicide, and this is a positive thing. Thoughts of suicide are sometimes caused by a mental disorder, so you should find out if the person has such a disorder. Avoid asking if one has a mental illness. Instead, ask if one is receiving help for any emotional or mental health problems. Clearly state that thoughts of suicide may be caused by a treatable disorder, as this may instill a sense of hope for the person. By discussing specific problems, you can help the person work out practical strategies for effectively dealing with difficulties and life problems that seem impossible to cope with. Find out what has supported the person in the past and whether these supports are still available. Ask the person what he or she thinks could help keep their mind away from negative thoughts. Find out whether there is anything important in the person's life which may reduce the immediate risk of suicide. Attachments to children, for example. Encourage the person to consider the consequences of suicide, especially the effect it may have on the people he or she cares about. However, do not make the person feel guilty or ashamed. Instead, focus on the importance of the person in the lives of the people they care about, the good things in the person's life, their hopes for the future, and other reasons to live. Encourage the person to think about their personal strengths. Passing time during the crisis. Suicidal crisis can last few hours or a few days. While the person is suicidal, whether you remain with him or her all the time as a family member or friend, or only for a short time, there is time to pass. You will need to find a way past this time. Suggest things to distract the person from their suicidal thoughts, especially things which are relatively easy to do and which will encourage a sense of control and achievement, like the hobbies of the patient or anything that he or she is interested in. It is preferable that the person chooses an activity which has been found helpful and enjoyable in the past. Encourage the person to spend time with their significant others, like family, friends, or religious leaders. After the crisis has passed, maintain contact, whether occasional or frequent, depending on the relationship, with the person and take steps to ensure that one receives professional help. In order to master this suicidal aid, please study it well, review, and please share and subscribe. Thank you.